right. This is my patient, Brittany. She's a volunteer patient. Brittany, we are going to be testing your cranial nerves today and doing a full neurological examination. So the first examination that I'm going to do is for cranial nerve number 1. I'm going to have her close her eyes and I'm going to have her smell something. I'll have you pull your mask down just under your nose. And can you tell me what you're smelling?
Peppermint.
All right, so I know that cranial nerve number 1 is intact. The next test I'm going to do is I'm going to look at her fundus in her eyes and check for pupillary responses. So I'll have you take your glasses off for a moment. She has good pupillary response. Her fundus looks normal. The next one that I'm going to do is 3, 4, and 6. What I'm going to have her do, Brittany, I'm going to have you follow my finger with your eyes. So those are intact as well. The next test I'll have you do is cranial nerve number 5. I'm going to have you just clench your jaw for me. And she's able to do that. Then number 7, I'll have you just pull your mask down for a moment. I'm going to have you give me a big smile. And can you puff out your cheeks real big for me? Perfect. And I know that cranial nerve number 8 is intact because she is hearing me, she is following all my instructions, and she's able to do what I'm asking. The next cranial nerve will be 9 and 10, so what I have you do is open your mouth for me. Yeah. And say ah. And I would be using a tongue depressor with that too, but I don't have one with me right now. So cranial nerve number 11, I'm going to have you shrug your shoulders for me, both. Perfect. And then number 12, I'm going to have you stick your tongue out for me. And can you move it side to side? Perfect. So we know that all cranial nerves number 1 through 12 are intact. And then next I'm going to test her cerebellar function. So I'm going to start with fine motor skills. So Brittany, I'm going to have you do a test for me. It's just going to make sure that you can use rapid movements. I'm going to have you take your hands and flip them back and forth. All right, perfect. And she's able to do that. And then I'm going to have you do just some toe taps on my hand. Rapid toe taps with the left foot, rapid toe taps with the right foot. That's intact as well. I'm going to have you stand up for me. I'm going to have you put your feet together, stand just like this. So we're going to be testing your Romberg. And I'm going to have you close your eyes and I'm going to count to 10 to make sure that you're able to stand and that she's not swaying. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. You can open your eyes. She didn't have any swaying, so we're not concerned for that neurological function. Next, Brittany, I'm just going to have you walk away from me. And I'll have you walk back towards me. So what I'm looking for is just her posture and her rhythm of her gait, that she has her arms at her sides, and she's not uncoordinated. So you can have a seat. Next, I'm going to test superficial versus painful response on the skin. So Brittany, I'm going to have you just close your eyes. I'm going to use your hands. And tell me if you feel something sharp or something soft.
Soft. Sharper. Sharp. Soft.
Okay, and I'm going to do it on your leg too.
Soft. Sharp.
Perfect. So that is intact. Next, we'll check her vibratory response with the tuning fork that we have here. Brittany, I'm going to hit this tuning fork and I'm going to place it over your joint. So I'm going to do both shoulders and both knees. And I'm going to have you close your eyes and I want you to tell me when I stop that vibration, okay?
Okay. No.
Perfect. I'm going to come to your other side here. I'm going to do the same thing.
No.
Perfect. I'm going to do your knee now.
No.
And I'm going to do your left knee now.
No.
Perfect. Okay. Next, I'm going to make sure that she can identify an object in her hand when her eyes are closed. I'm just going to use a familiar object that they have here in the office that she might know about. So I'll have you close your eyes, Brittany, and I'm going to place an object in your hand. And can you just tell me what that object is?
Marker.
Perfect. And then what I'm going to do is I'm going to have you keep your eyes closed. I'm going to take your hand and I want you to let me know if I'm moving your finger upward or downward, okay?
Up. Down. Up. Up. Down.
I'm going to do the same with your feet.
Down. Up. Up. Up.
Perfect. So you're able to identify an object, and she's able to identify if I have her fingers going and feet going up or down. Next, I'm going to see if she can identify 2-point discrimination and see how close I can get the 2 fingers without her realizing that it's just one area. So I'm going to use your cheek as an example, okay? I'm just going to pull your mask down just a touch.
Okay.
Do you feel 1 finger or 2?
2.
1 finger or 2?
1. 2. 2. 1.
All right, so she's able to distinguish between having 1 or 2 fingers on her cheeks. The next thing I'm going to do is I'm going to draw an object in your hand, or a number rather, and I want you to just let me know what that number is with your eyes closed.
2. 1.
Okay.
1. 2.
Perfect. And the last test I'm going to do as part of the sensory function is just to make sure that she can identify what part of her body I'm touching with her eyes closed. So with your eyes closed, I'm just going to touch an area of your body and I want you to let me know where I'm touching.
Shoulder. Hand. Foot. Foot. Knee.
All right, so she's able to do that. So next we'll move on to making sure that her deep and superficial reflexes are intact. I have a tuning fork here. I am going to start on her right side here. And I'll start, I'm gonna just have you relax your elbow here for me. And I'm just gonna hit kind of on the posterior aspect of the olecranon here to make sure that she has a reflex. Perfect. I'm gonna move here. I'm just gonna relax your hand right there for me. And I'm just gonna feel here, and I'm gonna hit my own thumb here, Brittany. So nothing you have to do, okay? Perfect. All right. And the last one I'm gonna do, just relax your arm here on my arm. Perfect. And I'm gonna move here to your patellar, and just relax your leg here. And I'm just gonna hit your knee here. I'm gonna make sure that your reflex is intact, okay? Perfect. And then I'm gonna do the Achilles here. I want you to just relax your foot for me. And I'm gonna see if she's able to press down on my foot when that happens. I'm gonna roll your pant leg up a little bit here. Perfect. Next, I would do the abdominal reflexes. I am not going to do that on Brittany just because I don't want to expose her here, but what I would be doing is having the patient lay down, and I would be testing all 4 quadrants with like a sharp object, such as a paper clip, moving inward towards the umbilicus to make sure that the abdominal muscles are responding appropriately. And then last, we'll do your patellar and your Achilles reflexes. So with the patellar, or we already did that, sorry. We'll test for ankle clonus next. So with that, I'm going to just push your foot upward. I want to make sure that she doesn't have any excessive reflex after I kind of jerk that foot in an upward motion. And it returns back to normal. We don't see any excessive tapping. And then the last thing I would do is the Babinski reflex on her. What I'm going to do, Brittany, is I'm going to take off your shoe if you don't mind.
Cool.
Hope your feet don't stink.
Hopefully not.
And I'm going to, actually I'll have you just lay back here. Move all my equipment. And what I'd be assessing for is I'm gonna go on the outer part of her foot here, and I'm gonna just make my thumb kind of go upward. And what we're making sure is that her toes aren't fanning out and that they're kind of just curling. So that looks intact as well. So I'll have you sit up here. And that would conclude our neurological examination. It appears that Brittany's neurological function is all intact, and she was a great sport about helping me out. So thank you, Brittany. And that concludes the neurological examination.